Okay, ladies and gentlemen, we'll get started here. This is teleconference 2020-12. Date is April 22nd of 2020. Good day, everyone. My name is Jason Rogers, and I will be the host of today's call. I'd like to call the meeting to order and inform all of you that this meeting is being recorded. Should anyone have objections to being recorded, you may disconnect now. This teleconference meeting will be run by the agenda and all attendees will be placed on mute so that the primary presentation may proceed uninterrupted. All questions during the teleconference should be emailed to ema@co.delaware.in.us so they may be addressed at the end of the meeting. The invitation for today's call also came from this email. Please do not place your phone on hold as a hold message will play to the entire group. When and if the conference mute is lifted, please keep all side conversations to a whisper and background noise to a minimum as it will be audible to the entire group. Should you wish to speak, please state your name and to whom you represent. Item number 1. The Delaware County Health Department reports Wednesday of additional individuals within Delaware County having tested positive through lab testing for SARS-CoV-2, the virus that causes COVID-19 infection, bringing the latest total to 135 confirmed cases and now 11 attributed deaths. The Delaware County Health Department continues working closely with the local and state officials to ensure that the contacts of the patients are identified and that all infection control protocols are being followed. Item number 2. The Center for Rural Health Policies Analysis, University of Iowa College of Public Health, has created a rural health data COVID map that is in the invitation to this call, the link, and it also gives some statistical information as it relates to rural communities. That was provided by Purdue Extension. Item number 3. The Cybersecurity and Infrastructure Security Agency, the CISA, released guidance on the Essential Critical Infrastructure Workforce 3.0. The CISA's Identifying Critical Infrastructure During COVID-19 guidance and accompanying a list are intended to support state, local, and industrial partners in identifying the critical infrastructure sectors and the essential workers. This list is advisory in nature. It is not, nor should it be considered a federal directive or a standard. Additionally, this advisory list is not intended to be the exclusive list of critical infrastructure sectors, workers, and functions that should continue during the COVID-19 response across all jurisdictions. Individual jurisdictions should add or subtract essential workforce categories based on their own requirements and discretion. Questions should be directed to cisa.cat@cisa.dhs.gov. Item 4. On April 16th, the White House released guidelines for opening up America again, providing a plan for rolling back social distancing measures and reopening the country's economy in several phases, depending on location. Under the guidelines, states will need to meet 6 metrics that include demonstrating a downward trajectory of COVID-19 cases over a 14-day period and a robust system for testing healthcare workers before they can proceed to a phased opening. Details of this plan are located at www.whitehouse.gov. Item 5. Some county and city departments that have completed the request for public assistance forms have seen an email from the PA email address that states, I am reaching out to you as I need to get your help in getting FEMA a rough estimate of what type of cost and dollar amount of expenditures that may be coming to FEMA from Indiana. I think they have that backwards. To Indiana from FEMA. This rough estimate will help FEMA be monetarily prepared to process reimbursements once they are ready to receive your documentation. Backup documentation is not needed at this time. All they are requesting is a one-page letter giving a narrative of the type of expenditures you will be claiming. For example, labor, PPE, cleaning supplies, a rough estimate of the total dollar amount for all the types of expenditures that you can list. They just are requesting a lump sum. Send that information to cgoodman@dhs.in.gov. Again, you do not need to send estimate or further information. Also, do not send the letter to the PA email address that had been provided earlier for public assistance. Remember, this is just a rough estimate and no backup documentation is to be sent. The bad news is that this information is needed by tomorrow, the 23rd, tomorrow afternoon at 1 p.m. All the applicants for RPA that have been entered into FEMA's grant portal have been sent an email. There are a few public assistance requests that they're still working on at IDHS, and they are trying to get the email sent out to all of the applicants. PA has sent out to over 600 applicants as of this emailing this afternoon. Item 6, ISDH still has a call center for the general public and medical providers. They're also answering questions with regard to essential employees. That number is 1-877-826-0011. Item 7, FEMA has provided contact information. If you have any questions, please contact the FEMA Office of External Affairs, Congressional and Intergovernmental Affairs divisions. Those contact informations and phone numbers were also under the notice on the invitation email that you were sent. I'll go through them very quickly. Congressional Affairs Office is located, the telephone number is 202-646-4500. The Intergovernmental Affairs telephone number is 202-646-3444. And the private sector engagement telephone number is 202-646-3444. Emails for all of those offices were included in the invitation for this call and will be in the notes of this agenda. Item number 8. The FBI's Minneapolis division, in coordination with the Office of Private Sector, OPS, Criminal Investigation Division, CID, and 3M Company, prepared a list and created an LIR, that is a liaison information report, to make the healthcare and public sectors aware of indicators related to fraudulent sales and solicitation of 3M personal protective equipment, or indicators of counterfeit 3M PPE, including the N95 respirator. The liaison information report is posted in the DC COVID Hub at dcema.com under important information and links. 3M has created a fraudulent hotline. That phone number is 800-426-8688 for the US and Canada to help detect fraud and avoid counterfeit products. In addition to the hotline, you can report concerns at www.go.3m.com/COVID-fraud. We now have some time for question and answer. When the conference mute is lifted, please keep all side conversations to a whisper and background noise to a minimum, as it will be audible to the entire group. Should you wish to speak, please state your name and the organization you represent. Please do not place your phone on hold, as a hold message will play to the entire group. The conference mute has been lifted.
Jason, this is Emily Anderson, Court Administrator. What was that email address for the rough estimate?
If you received the email from the PA email, you can send your rough estimate to, I'm gonna make sure I get this right here. It is C. Charles Goodman. It's C. Goodman at dhs.in.gov.
Okay, so if we've not requested funds, but we're planning on requesting funds, we can't do that right now.
No, you need to go to PA site, and I will follow up with an email with the form that you will need to fill out and then email to the PA at dhs.in.gov. So I'll send you an email, Emily.
Thank you.
Are there any other questions?
Jason, this is Jeff Steiger. Can you hear me okay?
Yeah, Jeff, go ahead.
Hey, Jason, I know that there's going to start being questions as we have the rolling opening of things, and I know that the county health department and or you are going to be putting out guidelines as far as what business restrictions or limitations they're going to have. For example, like the beauty salons and barber shops. Where will we be able, or where will they be able to get that information? Because we're going to have people call in our district wanting to know what each county is, what their restrictions or what their availability is. Will you guys be putting that out? Will the health department be putting that out? Or where can we send people to their county specific openings?
Specifically for, in your case, because the state police district covers so many counties, I would direct all those questions to the local health department. We will not only, our local health department will have that information, but we will also have it at emergency management, and we'll place it on the COVID hub for Delaware County specifically. But any other counties, I can't speak for them, so I would direct those questions to the health department.
Excellent. Thank you.
You're welcome. I have a question from Ryan Remington in regards to any FEMA reimbursement. Are grants allowed to be counted in that reimbursement? That is probably a question that would need to be sent to the PA email, Ryan. That's what I would follow up with, and I would guess probably not, but I can't speak to that specifically because we've not had that situation here locally that I have dealt with. So my recommendation is to send that question to the PA email address.
Hey, Jason, Jimmy Duckman, Ball State. Is the expenditures that we've spent up to date going to be in that letter? But what about going forward? Are we going to be having to resubmit? Is that the concept?
Yeah, she just is trying to get a basic idea of what the dollar figure for the state is going to be in the ballpark of for FEMA. And I believe this is unprecedented. We've never done it this way before. Typically they'll say from this date, which I believe is January 27th or something like that, to the date that they have decided that it ends. You will then collect all the data, get all the information, all of your paperwork, all of your pay stubs, tickets, receipts, all that stuff would come together, and then you would submit that under a part of, like in this case, type B work for FEMA reimbursement. However, because this is every community, every city, county, and state, they're trying to get their head wrapped around what the dollar figure may be. I will tell you this, I believe that they will be very, very picky on any paperwork that you are not able to provide, and will exclude any expenditures that you can't back up specifically related to COVID-19 response and recovery. Again, I said item or category B work is like protective measures. So your PPE, those types of things that you're doing specifically have to be for COVID-19 response, recovery or mitigation. So I can send that out under, or I can send an email out to this group as well. If you're interested in seeing that again, it's a lot of reading. As far as what category B is. At this time, she doesn't want all that information, just a rough estimate from the end of January till essentially tomorrow, what you think you have spent.
Without knowing, this is one of the largest insurance co-ops, Kristen's part of them.
We will probably be breaking ours down into those categories in cleaning measures, personal protective equipment, personnel, overtime, and other items that are in reference to the COVID-19 response. So I can't speak to everybody and what all those things that may apply to that could be, but I do know that those expenditures have to be within that category B that FEMA has said. So if anybody has questions, please email the ema@co.delaware.in.us, and we will get that information back to you if you have a specific question.
we want to get it done sooner than later because there'll be a lot of Medicare. So we feel better about our other fees.
Any other questions?
But whatever the recommendation.
Okay, the conference mute has been engaged for closing. Thank you for joining the conference call today. The Community Leaders Teleconference has been transitioned to once a week. As this continues, it may also be pre-recorded in times and used in the future as sent out as a audible link. At this time, we will continue these calls on Wednesday. The next call will be Wednesday, April 29th at 4:30 p.m. The next update will be announced via email. Thank you for attending today.